Hi, Lisa. Welcome to the podcast.
Thank you for having me.
You're welcome. I'm excited to dive into all things fertility awareness with you, and I thought you'd be the perfect person to have on to discuss this subject.
Oh, well, I'm really excited. I mean, as you know, I talk about this all the time. In my bio, too, a lot of my friends would laugh. My bio starts with, Lisa talks about vaginas a lot. Because it's true.
Yeah, that's fine. We love it on this podcast. We're talking about poo, vagina, cervical mucus, all that good stuff. So don't hold back.
Awesome.
So why don't you start off by telling us a bit about yourself and what made you initially start the podcast, and with your latest book that we'll kind of cover as well, what made you want to write a book as well?
Well, I actually learned about fertility awareness almost 20 years ago. So I was right out of high school. I discovered the method. I was looking for a non-hormonal method because I didn't completely trust the pill, and I also just didn't feel comfortable being on a hormone like long term. That was just something that didn't feel comfortable to me. So around that time is when I discovered fertility awareness, and it was just amazing to learn that you're not fertile on every single day of the cycle, and there's also a way for you, like just as a woman, to kind of organize your, understand your cycles and organize your sexual activity in such a way that you can avoid pregnancy without having to rely on any external measures, essentially. So for me, that was really appealing. And so I learned the method, and then very soon after that, I took a course and began teaching women in my early 20s. And what prompted me to start the podcast, I mean, by that time I had been, sorry, I'm not sure if you can hear that.
No?
Okay. At that time, I had been charting my cycles for about a decade or so. I just had my first son. So after avoiding pregnancy for, I don't know exactly how many years, but almost 10 years, my husband and I decided to start trying. And it was right around that time that it kind of hit me that I had been able to take for granted this information about my body and my cycles for all these years. And the average woman still doesn't know how her fertility works. So many women are struggling with infertility, and they wouldn't necessarily be able to pinpoint their date of ovulation, because this information, although I'm very familiar with it, is still, even to this day, not common knowledge. So that prompted me to start the podcast, and the book was an extension of that, because I really felt like I hear women all the time like saying like, oh my gosh, this is information, everybody needs to know this stuff. My aim was to just create a resource to add to this conversation, instead of trying to wait and hope that eventually our school systems will catch up and start teaching women about their menstrual cycles.
And yeah, I'm not sure what it's like now, but what is like the sex education like in schools? Is it still basically you can get pregnant every single day of the month, your periods are dirty and gross and embarrassing, or has it evolved a little bit, or are you not aware of that?
I'm not entirely sure. I think it's likely a bit different, because I mean there is this positive period power movement happening right now, and a lot more women are talking about it, but I still haven't met very many women who have not learned that they were, the party line that we could get pregnant on any day of our cycles. And the majority of women I've spoken to in my lifetime, both young and older, were all taught this misinformation about the cycle. So I'm sure that it's slightly better than when I was growing up, but it still has a long way to go.
Okay. And I do want to dive deep into fertility awareness method, including all of the different factors to pay attention to. But first, I want to talk a bit about the menstrual cycle itself, because that obviously plays into how to do fertility awareness. You need to do certain things at certain times or avoid certain things at certain times. So what does a healthy menstrual cycle look like? So the people that I work with, the women, they're struggling with painful, crampy periods, very heavy every single month, maybe erratic. They just don't know when it's going to turn up, and they don't actually think that's abnormal, because it's something that they've dealt with, the parents have dealt with. It's common, but it's definitely not normal. So what would you say is classed as a healthy cycle?
Well, I think the first thing is, when I talk about a healthy cycle, I want to be clear that I'm not just talking about the period, because oftentimes I'll say menstrual cycle, and basically the only thing that we consider is a period. And I mean, that is something that is just due to the education, like kind of the limitations. So it's not just like you have your period and then like fast forward then there's the next one. We want to talk about the whole cycle. So day 1 of the cycle is the first day that you have a true flow. The first day, I often say that you have to do something about it. So typically, if some women experience a couple days of spotting or something like that before their period starts, we would look at the first day of flow. And then we would consider the menstrual cycle from that day until the last day before your next period starts. So overall, a healthy cycle can range in length anywhere from about 24 to 35 days. And that's important as well. A lot of just learning about what a healthy menstrual cycle can look like is myth busting. And the myth is that all women have 28-day cycles and ovulation always happens on day 14. And so a lot of women might have a cycle that's 30 days sometimes, or 32 or 27, and she might think that there's a problem. So the length can vary, and just because your cycle isn't 28 days doesn't automatically mean that there's a problem. And, ovulation in a healthy cycle, because the cycle can range, ovulation can happen, in a typical cycle as early as on day 10 or as late as day 22 or day 23 or something like that. And so I think that's important as well. It's important for women who are trying to get pregnant, because a lot of women will time sex on day 14. And depending on the actual length of their cycle and when ovulation is really taking place, they might inadvertently be using fertility awareness for birth control. So to take you kind of through the cycle then, in a healthy cycle, your period would be anywhere from about 3 to 7 days. And you would expect it to kind of start moderate or heavy and then gradually taper off. We lose about 90% of our total bleeding by the 3rd day. So it does make sense, and most women have experienced that. You mentioned pain. A lot of women do experience pain with menstruation, and I think it's important to make the distinction. It's really common for women to experience pain with menstruation, but that doesn't make it normal or healthy. And I think for a lot of women, they've never heard anybody tell them that. It's almost just that, like, the expectation is your period is supposed to be hard and painful and horrible and awful and blah, blah, blah. So pain in any other situation outside of the context of your uterus is considered to be a problem, right? If you had like serious heavy pain in your shoulder for several days out of every month, we would be concerned about that. So it's important to question this assumption that just because the pain is happening in your uterus and it's very common, that automatically it's completely okay. So, pain is a sign of inflammation. And with women who experience period pain, what the research shows is that they do have higher levels of those inflammatory markers. So in particular, prostaglandins are a lipid that's associated with inflammation, and it's necessary for us to create prostaglandins to help the uterus kind of contract, to help us effectively release our bleeding during menstruation. Women who have period pain have been found to even have 4 times the levels. So yeah, I feel like I'm kind of going on a tangent, but I feel like it's an important one, because it's like, no, it's not normal to need to like to be in like extreme pain, like but it is common. So anyways, that's the healthy period part. And then after your period is done, and I suppose one other thing just to say about the period is it should have like a beginning, a middle, and an end, and then be over. So if the period kind of keeps going on, if the period is excessively heavy, if the period is excessively light, all of those things can be an indication of an issue.
Mm-hmm.
And so after the period is done, you would expect to have several days before you start to actually see your cervical fluid. So cervical fluid can look like clear, stretchy, kind of like raw egg whites. It can look like creamy white hand lotion, kind of like that sticky texture. It can also, for some women, they don't necessarily see a lot of the mucus. They can stretch between their fingers, but they might notice that at a certain time of the cycle, they wipe themselves when they go to the bathroom, and it's like, phew, really slippery. Or they feel like they have to wipe a bunch of times to kind of like get it. Like, it just feels like there's more there.
Yeah.
So however you experience it, in a healthy cycle, you would expect to see mucus at least 2 to 7 days, and you'd expect it to lead up to ovulation. So in a healthy cycle, you have to ovulate. And then after ovulation, you would expect that your period come about 12 to 14 days later. So a healthy second half of the cycle, we would want it to be at least kind of like that 11, 12 days. And that kind of takes us through the cycle. And I think for a lot of women, just to kind of hear that broken down in that way, it's not something that we're necessarily told about, taught about, all the things that happen in between. And I also think it's helpful and important because when you can understand the different parts of the cycle and what healthy looks like, then you can start to appreciate that if any one of those different aspects are off, if you have too much mucus, if you have no mucus, if your luteal phase, second half of your cycle, post-ovulation is too short, if your period is, all these things are going on, any one of those things can be an indication of a specific issue that you might be facing health-wise.
Mm. And when you were saying about the differences in the cycle length, so from anywhere from 24 days, I think you said, until 35 days, if someone was every month having a cycle day on 24 and then the next month 35, is that still classed as regular, or is that irregular because it's within the ranges but it's not kind of consistent every month?
Well, that's a really great question because a lot of women would think that if their cycle is once occasionally 34 days, that means it's irregular. So the definition then of an irregular cycle would be if your cycle fluctuates more than, say, 8 days at a time from cycle to cycle. So yeah, if your cycle was 24 days one cycle, 34 days the next, 46 days the next, or if you have fewer than 5 or 6 periods in an entire year, then that certainly meets the definition of irregular. I think it's also important just to kind of point out that for any woman that's keeping track of her cycles over any length of time is going to notice that at some point in her life she might have a random cycle that's longer or a random cycle that's shorter. And so if you have that experience, it doesn't automatically mean that there's a problem either. What is more indicative of an actual issue would be a consistent pattern when you actually see these irregularities and they persist cycle after cycle.
And you mentioned about the short luteal phase. So when you ovulate, if that's lasting less than 10, 12 days, and you're getting your period quite soon after ovulating, why is that a problem? And what could that potentially indicate?
Well, so if your luteal phase, the second half of your cycle, so it's basically the time between ovulation and your period. So for women who are listening who have charted their cycles before, if they're charting their temperature, you see the temperature rise and stay high. So basically, that would be basically like 10 or less days of this high temperature, and then your period comes. So the reason that it's a problem, there's a couple of different reasons. I mean, when you understand the hormonal cycle that is happening in the first half of your menstrual cycle, as you approach ovulation, the follicles are developing in your ovaries, and those follicles are producing estrogen. And estrogen is what triggers like the cervical mucus production, and when it reaches high enough, that's what inadvertently triggers ovulation. Progesterone, we only produce significant amounts of progesterone in the second half of the cycle. And progesterone plays a really important role to counter some of the effects of estrogen. So estrogen is associated with cell proliferation and growth. So estrogen grows our uterine lining. But we also know that too much estrogen is associated with certain cancers because it's associated with that cell proliferation. So progesterone, on the other hand, is what helps with the cell maturation. It teaches the cells so estrogen is causing everything to grow, and progesterone is helping the cells to mature and directs the cells in what they need to do. So they play an important role, kind of balancing each other. And we often think that the menstrual cycle is only related to whether or not you want to have babies, or only related to reproduction. But these hormones are, ovarian hormones, estrogen and progesterone, play a crucial role in different areas of the body outside of our period, in our breast development, our bone development, our heart development. And so when your luteal phase is too short, it's an indication that you're not producing enough progesterone. For example, if you're producing a significant amount of progesterone every day in a healthy luteal phase for 12 days, well, if we shorten that luteal phase to 10 days, you're getting 2 days less of this progesterone. So there has been research done in different areas, particularly with regards to bone health, where women who regularly have a short luteal phase, who are then producing less progesterone, are more likely to experience a greater degree of bone loss. So it's interesting, right? Because who would ever think that your period would be related to how your body develops bone as you go throughout your life? But yeah, so that's an important indication. Outside of that, however, for women particularly who are trying to conceive, if if your luteal phase isn't long enough, then that can inhibit your chances of conception. So the way that conception happens, so, you know, in your menstrual cycle, you ovulate, and when you ovulate, your like the fimbriae, like the little, if you, I always use my hand, kind of picture the uterus, you know, like you have the uterus itself, and then you have the fallopian tubes, and then you have the ovaries. So you ovulate, and then the egg actually goes into the fallopian tube. And fertilization happens in the fallopian tube. So if in a cycle where conception happens, that means that the woman would have had sex prior to ovulation, and the sperm is, our cervical mucus can keep sperm alive up to 5 days. So you have this sperm that's actually living, it's like hanging out and surviving in your body, it's living in your cervix, and it's waiting in the fallopian tubes. So when you ovulate, the sperm is already there. It's like the greeting committee or something, like at the airport. And so fertilization then happens in the tube, and the egg starts to kind of develop and grow. And it takes about a week or so before the egg develops and grows and makes its way out of the tube. And then it takes about another week for the egg to find its way into the uterus and find a nice warm place to implant and kind of make its way into the endometrial lining and fully be covered over. So this process of fertilization and implantation takes about 2 weeks. So if you are having your period already on day 9 or day 8, like after you've ovulated, or day 10, then what can happen is, even if the egg was fertilized, it couldn't successfully implant. So you're literally like, the egg is trying to implant while the uterine lining is being shed. So from a very practical standpoint, that's one of the ways that charting your cycle can help you to identify issues like that. Because you can appreciate that if you weren't charting and you didn't know this, you would never know. You would just, like, you know, try to get pregnant and get your period and just think, you know, but when you kind of have this understanding of the cycle, then it's like, oh, okay, I understand how this works. Okay, my luteal phase is too short. I need to figure out how to extend it. And I mean, it's helpful to know that it is possible. There's a lot of different reasons why something like that might happen. And stress, that might not be anyone's favorite thing to hear, but often stress or overexercise or a lack of sleep, or, you know, certain things in particular can contribute to that type of thing in the post-ovulatory phase.
And stress isn't just like psychological stress either, is it? It's not just what people think. They might think, oh, I don't have a stressful lifestyle, my job's not stressful, I'm fine. But it could be that they are over-exercising, maybe they're not eating enough, maybe they have chronic inflammation in the body that's stressful. So don't necessarily rule that out as a problem if you're not mentally stressed, because there are multiple different types of stress as well. And if someone is tracking their cycle and they may be doing ovulation predictor kits or a blood test and they're showing low progesterone levels and they're not ovulating, what other reasons could there be? So stress, again, that could delay ovulation, or it could completely stop ovulation in some cases. But if someone is kind of doing all the right things, they are trying to manage the stress the best that they can, what other things could they look into?
So are you asking what we could do specifically to try to improve the luteal phase length in particular?
Yeah. Or are some of these things the same things that would prevent or stop ovulation as well? I feel like there's a lot of similar factors that could be leading to both.
I mean, yes and no, in the sense that, so with the luteal phase issue in particular, I think it can be different than the things that could stop ovulation. So maybe I'll kind of address.
Yeah,
but a lot of, so what you mentioned is absolutely right, and it's an important point to make, which is that when you think of stress, we often think of like the boss yelling at you or some specific event or situation that can be stressing us out. But if you think about what is the main stress hormone, cortisol, what other situations could, you know, trigger the excessive production of cortisol? So in terms of addressing it, I think that it's often, I don't know if it's frustrating, or like, I think we're as a culture, we're so used to hearing about like magical pills and supplements. And so often you might expect someone like me to list a whole bunch of supplements that you could take as the solution for all of this. When I'm working with a client who has a short luteal phase, I mean, the first thing we have to do is like have a conversation to try to figure out what it is that could be at play. For some women, it can be something like an endocrine issue. If they have a thyroid issue, that is basically causing them to experience what I call like a low hormone kind of cycle, where you can kind of see these signs of low mucus production, short luteal phase, and it's kind of all kind of happening together. It can be something like an underlying infection, a gut problem. If you have like somewhere on the IBS spectrum and some other type of gut issue, well, that's associated with chronic inflammation in the body, which is going to raise the cortisol levels, which is going to have an effect on the progesterone. We make cortisol from progesterone. So if you're like super stressed out, you're like it's literally like your stress is literally made from your progesterone. Just FYI. So those types of things can affect it. And I think one of the things, as women, we hear about stress a lot, and with charting, it's one of the times where you can see a physical representation of how stress is impacting you. And all stress isn't acute. So we have the situational stress of like, something happened to me today, but then we have the chronic stress of like, I'm working 70 hours a week, and I've been working 70 hours a week for 6 years. So I think that depending on what's happening in your life, for some women, it's like a wake-up call of like, okay, I really have to address these issues. You mentioned the over-exercise and the under-eating. One of the things that I've had a number of conversations with clients, because exercise is the thing they're doing to manage the stress.
True.
But then depending on the level of exercise that you're doing, if you're exercising 6 days a week, twice a day, like that is no longer, like it might feel like you're reducing stress, but on a hormonal level, you're increasing the stress hormone, right? So there's a lot of different pieces to this. And I would say that the first step would be to look at the lifestyle factors, like literally like, what time are you going to bed? Are you sleeping in the dark? So you can't produce optimal hormone levels when you're not sleeping. And when you're not sleeping in the dark, you're not going to produce the maximum amount of melatonin that you can, and that's going to impact your progesterone production. So I think for a lot of women, they're just shocked that like going to bed on time and sleeping in the dark can literally lengthen the luteal phase sometimes a day or two just by doing that. I'm not promising it for everybody, because like I listed all these different reasons that could be contributing, but this is kind of the mindset shift. And then, I mean, if none of those things work, or there are obviously different supplements you can take to try to improve your progesterone production. So for instance, like magnesium is well studied in the post-ovulatory phase, because it has this calming effect on your body. A lot of women will find that they sleep better, and it does help to promote progesterone production. But again, a magical supplement isn't going to like fix everything if you're not looking at the lifestyle factors.
Exactly.
So that's like the post-ovulatory phase part of it. But then like in terms of the things that could disrupt ovulation, the things that could delay ovulation, again, that's its own kind of kettle of fish. So obviously stress, acute stress, so a situational event or something like that, like and it doesn't have to be bad. You can be getting married or going on a vacation or something like that. And if that occurs before you've ovulated, that can actually delay ovulation by several days. But it can also be related to, again, conditions. Thyroid conditions can disrupt the menstrual cycle, can disrupt menstruation, can change menstruation, make the periods heavier or lighter. Chemical exposure, xenoestrogen, all of the different chemicals and all of the products that are specifically directed to women can have an impact on the menstrual cycle. So just to kind of put that out there. In the case of polycystic ovary syndrome, an issue that is characterized by a high level of inflammation, glucose intolerance, meaning that your body doesn't really process sugar well. That can have a significant impact on ovulation. And so a classic PCOS chart in a woman who's struggling with that issue, that's more of the situation where you're having fewer than like 8 or 9 cycles a year, when you're regularly swinging, your cycle length 8 days or more, you're going like 36 days, 42 days, kind of that kind of stuff. It's quite common to see that kind of present that way. And then if a woman is losing her period entirely, like 6 months or a year at a time, that's often a different thing. So it's kind of the difference between over-exercising and having it shorten your luteal phase by a couple days, to over-exercising and under-eating to the point that your period stops altogether, or if you're under excessive stress. So Obviously, there are a lot of different factors that can be at play here, but I think the overall point that it comes down to is that your menstrual cycle is a vital sign. And like step one is to kind of understand and appreciate that your cycles are connected to your overall health. And when you're seeing some sort of issue that falls outside of the normal range and you're seeing that persist, then we need to look deeper because there's some actual reason for that. It's not just happening in isolation or in a vacuum.
Yeah, and that's the title of your book, The Fifth Vital Sign. Do you want to just go over what you actually mean by that? Why is your menstrual cycle classed as a fifth vital sign?
Well, yeah, I mean, the most common vital signs that we're familiar with are, say, our heart rate, our body temperature, respiratory rate, blood pressure. And when you think of any of those signs, so take blood pressure, we have a very clear understanding that your doctor is going to have a range of what's normal. So if your blood pressure is too high or too low, it's going to tell your doctor that there's an issue. But beyond like the general sense of like, okay, this could be a problem, if your blood pressure is too high, it's also going to tell your doctor where to look. Like there could be very specific reasons why the blood pressure would be high. If the other vital signs, you have the sense of if it's too high or if it's too low, that it could indicate a problem. It also provides a specific roadmap as to what that problem could be. And so when you think of the menstrual cycle and you take it into all the different aspects, we talked about the period, we talked about the cervical fluid, we talked about ovulation, we talked about the total length, we talked about the luteal phase. So any of those pieces of the menstrual cycle, not kind of going haywire or going outside of the normal range, not only does it tell us that there's something going on, but it would also, to someone who's trained and who knows the connection between the cycle and the overall health, they would be able to say not only like, okay, there's something wrong, but like, oh, in this case, this could be an indication of this or that. So that's why we can look at the menstrual cycle as a vital sign. Even how I mentioned that, because your question about, you know, why is it a problem if your luteal phase is too short? And I mentioned that there's a connection between your menstrual cycle and bone loss. So if a woman loses her period entirely, as is the case often in hypothalamic amenorrhea, so HA, when she stops ovulating due to the combination of, you know, overexercise, undereating, or stress, what happens is when you look at the data, women who lose their period for an extended period of time, they do lose bone mass at a greater rate. And it puts these women at a lifetime greater risk of developing osteoporosis. So that would indicate that we should be paying attention to our periods because it is giving us this feedback continually about the status of our overall health.
Yeah, we're just never taught that, are we? We're just taught that your period is you just didn't get pregnant that month and that's all that matters, and next month it's going to come again, just prepare for it, and nothing else is really interesting with that. And that's completely not the case. There's just so much information, and it's like your report card every month, isn't it? When you get your period, there's so much that the amount, the texture, the colour can tell you about what's going on with your health as well. But I feel like for some women, not having a period at all is perfect. That's like what they're aiming for. If it goes missing for a couple of months, that's a bonus. And even when they go to the doctors, maybe a bit suspicious of some issues with the cycle, maybe it is irregular or particularly heavy one month, the recommendation from the doctor is to go on the birth control pill the majority of the time. I'd say 99% of the time, that's what they're told. And I love the kind of analogy in your book that it's like the smoke alarm going off in your house. And instead of doing something about it, investigating what's going on, addressing the fire that's kind of raging in the house, it's like just putting your headphones in or taking the batteries out and just ignoring it. And that's what going on the birth control pill is when you're doing that for any imbalances or symptoms that you're having. So what would you say is what's the problem with that? Obviously, people can understand what the issue is, but why is the pill not the answer?
Well, I mean, it's a big topic, obviously, but the pill, put simply, the pill isn't the answer because the pill doesn't cure or fix anything.
Mm-hmm.
So that's pretty much
despite what we're told.
Yeah. So I mean, first of all, the pill doesn't regulate the menstrual cycle. I think it's really important to question language and to kind of pay attention to how we talk about things. And the little white lies about the pill that we're told are, you know, the pill it regulates the cycle, and then also that it tricks our body into thinking we're pregnant.
Mm.
So let's talk about what the pill really does.
Yeah,
So
please.
the majority of hormonal birth control methods contain like a combination of synthetic estrogens and progestins. So I think first and foremost, we're often told like, oh, it's just estrogen and progesterone. Like, it's not. So in order to patent drugs and sell them on the market, you have to make a product that is different enough that you can actually like put your name on it. So what they actually make these synthetic versions of our natural hormones in labs, they don't exist in nature, so that they can patent and sell them. So first and foremost, like, it's not the same. So therefore it's going to have different effects in the body because it's not the same as our hormones. And so when you're taking any of the combined methods, which include the pill, the patch, the ring, all of the different applications of it, and all hormonal contraceptive methods, they operate in in a combination of three main ways. So, the first thing that most of the contraceptives do is suppress ovulation. So they basically interfere with the communication between your pituitary gland and your ovaries and stop you from ovulating. Now, not all methods, hormonal methods, completely stop ovulation. So we know that certain methods, you might be able to ovulate either semi-regularly or randomly, sporadically, but it's still happening. And so the state then, when you suppress ovulation, considering that our ovaries are what make our normal hormones. So if we're not ovulating, we're not making normal levels of our natural estrogen and progesterone. So by saying that it regulates the cycle, it actually shuts down the cycle and it replaces our natural cycle with a fake chemical cycle. So when you're on, the pill or other type of hormonal birth control that you take for a while and then you have like a couple days off, then the bleeding that you experience is not a true menstrual bleed. It's actually a withdrawal bleed. It's a bleed that happens when you take away the artificial hormones. In order to have a true menstrual bleed, you actually would have to ovulate. And then the effect of the estrogen on the endometrial lining in the first half of your cycle and progesterone in the second half, that's what's going to cause you to have a true period. So yeah, step one, it doesn't regulate your cycle. It gets rid of the cycle and replaces it with a fake one. The myth about it being like you're pregnant, well, when you're pregnant, it's a natural state where you're producing significantly more estrogen and progesterone than you ever would in a natural cycle. And by the time you hit 40 weeks pregnant, your progesterone levels are more than 10 times what you would ever experience in a cycle. So it's a completely different situation altogether. So if you were to look at the natural hormone production of a woman on birth control compared to a woman, say, in menopause, that would look more similar. Because in menopause, your ovaries are inactive and you're not producing significant amounts of estrogen and progesterone. So really, it wouldn't sound good on the marketing, but you could also say that the pill, puts women into an early chemical menopause, and that's why we're not able to conceive.
Yeah, I think they lose some sales with that claim.
Yeah. Well, and the thing about it though is you can't really badmouth it for that, because that's why it works. So, step one, shutting down ovulation. Well, if you don't ovulate, you can't get pregnant. So that it needs to do that in order for it to have the efficacy that it does. So like the other two ways that it works, it prevents the endometrial lining from ever fully developing. So the endometrial lining when you're on hormonal birth control is quite thin. Too thin in most cases to support a pregnancy. So even if an egg did somehow pop through, the endometrial lining itself isn't fully developed. And then it also prevents your cervix from making any of that cool cervical fluid that we were talking about. So the sperm can't even gain access to your uterus. So for instance, like the hormonal IUD, a lot of women gravitate to that because in some cases, some women do continue to ovulate. I think it's important to point out that not all women continue to ovulate, but some do. And so for a lot of women, that's appealing because it's not completely shutting down ovarian function. But these other factors are present. So it is interfering with implantation and it is disrupting your normal ovulatory function, but perhaps not to the same degree as some of the pills that fully just shut it down.
Yeah. And what about long term? Is there any evidence or maybe anecdotal evidence that the pill impacts your fertility and your hormones long term? So when someone comes off, I know that some people struggle with regaining their cycles and maybe some like post birth control syndrome type symptoms. But long term, does it have any impact on your hormone, your ovulation, anything like that?
Well, I mean, I would love to be able to sit here and say that we have evidence that the pill has, long-term effects on fertility, but the evidence doesn't support that. What the evidence shows is that there is a temporary delay in the return of your normal fertility when you come off the pill or other hormonal birth control. And the length of time that you use the pill, so for instance, if you used it for 6 months versus if you used it for 10 years, that is going to kind of increase the likelihood then of kind of like a greater delay. But so there's a couple different ways that this is studied. So one of the ways it's studied is in these time to pregnancy studies, where they actually have women who weren't on hormonal types of contraception and then women who were on hormonal birth control, and they just study them to see how long it takes them to get pregnant post pill. And so for the the regular combined contraceptive methods, on average it takes about twice as long. So the woman who isn't on the hormones, on average, it would take about 4 months to get pregnant. But the woman who comes off of the pill, on average, it takes about 8 months to get pregnant, which obviously means some women get pregnant earlier and some women get pregnant later. And it's important to note that these studies don't necessarily confirm a live birth at the end. Not all pregnancies result in not all pregnancies go to term. I think it's important to say that as well. And you're at an increased risk of miscarriage immediately if you get pregnant immediately post-pill. Other types of contraceptive, like the shot, has the longest delay. So women coming off the shot, on average, takes 18 months to conceive. So I think that is important. I think just to think about the mindset that a lot of women are in, especially if you've been very diligent and responsible, preventing pregnancy all these years. Everything finally comes into line. You're finally with your person and you are ready to start a family. 8 months, in the way the research reads, it often kind of downplays that because it is reversible. So it is like, what's the big deal, right? It's just 8 months on average. But then you take an actual woman. Well, after a lifetime of being taught that we could get pregnant every single day of our cycle, the first couple months you might be okay, but by the third and the fourth month that you are having sex and not getting pregnant, we're already freaking out. So by the time you get to the 8-month, 9th month, a year mark, we're already in the fertility clinic. So that's important to know, that there is this temporary delay so that we can start to get into the mindset of like, just like we prepare for all these other things that happen in our life, we prepare for our careers, we prepare for marriage and all that kind of stuff, we should be preparing for pregnancy. And my recommendation is, if you're on a hormonal method, to consider coming off of it 18 months to 2 years before you're ready to start trying. Not because it's impossible to get pregnant right off the pill, but you don't know what's going to happen. We know that there's this temporary delay. And so if you get off the pill before you are like, so I'm suggesting come off the pill like when you're still actively avoiding pregnancy. And my suggestion for that is because then you give your body the time to rebound and to recover and to just reestablish itself before you have any pressure of trying to get pregnant. And if you're charting your cycles, you can also watch your cycles and see if they're falling into line or if you do have any problems. One thing I will mention that's really important is that when you look at the research on the pill and how it impacts fertility, they will specifically exclude participants who had issues with their menstrual cycle prior to using the pill. So if there was a woman who never knew when she was having her period, like hadn't had her period for 6 months and then was put on the pill, they are not allowed to be part of these studies because the researchers know that the pill doesn't fix or cure anything. The pill masks the problem. So if you had an issue with your periods and you had 6 periods a year or less and you didn't know when your periods were coming and you went on the pill, it gives you a fake withdrawal bleed every 28 days so everyone can feel better. It's like a pat on the head, like it's okay. But there was an issue that was causing that. And that issue is still there if it hasn't been addressed, So in the analogy that I brought up, that you shared from the book, the fire alarm analogy, like when you take the pill in a situation like that, you're putting the tape over the alarm. Like the fire's still burning, but you're just masking the symptoms. So your body's one way of trying to communicate to you is now shut, like you just shut it up. So what happens then is that women who had issues with their cycle prior to being on the pill are then at a greater risk of having a delay in however long it takes for their periods to come back. It's not so common, but there are obviously women who come off the pill and their periods don't come back for like 6 months, 12 months, 5 years. The pill doesn't cause that. The pill doesn't cause a woman to lose her period. But what we have there is a situation where there's an actual underlying factor that is preventing her from menstruating, and the pill was masking it. So when she came off the pill, now you can actually see that there's a problem.
Yeah, and the pill, like you said, is so effective because it shuts down your hormonal communication. Your ovaries aren't working like they usually do. It also depletes nutrients. It can affect your gut health, your microbiome, creates inflammation. All of these things can, if you're already eating a poor diet, those types of things, then you could be in a worse situation coming off the pill as well. We've mentioned the fertility awareness a few times now, so I want to go into that in a bit more detail. How effective is the fertility awareness method? Is it as effective, or is it something that you need to be really careful with?
Mm-hmm. No, that's a great question. I do want to just say before we move on about the pill, because I definitely come across as anti-pill sometimes because I'm talking about all the research and I'm talking about the effects, and we didn't even get into like the long list of the side effects, which is extensive and a little bit, disturbing and disruptive.
Yeah.
I think it's just important. I like to clarify, I think that women, we need to have access to all the different options available. My main issue is that we're not told. So for me, it's not that women shouldn't, ever use the pill, because we all have to make these choices for ourselves. But what I think is we need to be aware and informed about how it can affect us, because my heart just breaks for women who don't know that there's this temporary delay. It's such an easy thing. You could just tell us and then we would know, right?
Yep.
And then we could just like organize it so that we come off of it, even 6 to 12 months beforehand. So yeah, I just want to clarify. It's not that I'm saying like never use the pill. I mean, I would like to, but that's just not, it's not up to, every woman has to make her own choice about what she's going to use. And so I think that, yeah, we just all need to have that information available to us so that we can make informed choices. So that's it.
I agree with that, definitely. Yeah, informed consent. If you're happy knowing all of this information, that there may be a delay, that there may be some negative impact with your hormones, your nutrient levels, and there are actions that the steps that you can take to kind of counter some of that and, like you say, organize and plan. If you're happy with that, then go ahead. I fully support you, but it's for the women who aren't aware, who aren't told anything, and then it can lead to a lot of stress, heartbreak, and lots of money spent trying to investigate what's going on when they could have been told from the get-go.
Mm-hmm. Well, and we have an intense focus on preventing pregnancy in our culture, which I completely understand, because I wanted to have babies when I wanted to, not when I didn't want to, right? But at the same time, I wanted to have babies when I wanted to. That's the key. I think that we often forget that women also, we have to support both ways. We have to support women to be able to avoid pregnancy when they don't want to, but when they are ready, we can't be having all these barriers to them conceiving when they're ready. And so not being educated about how the pill can have this temporary, there's no evidence to show it's permanent, but it is temporary. Like, it takes a bit of time for your body goes through a transition phase post pill, and it takes, time for everything to normalize. We need to know that so that there's no barriers when we're ready to get pregnant. And I think we need to support women as much when they want babies as when we don't want babies. Both things have to be supported.
I agree, definitely.
So when it comes to the fertility awareness method, one of the questions that you had was like, how effective is it? Is it really effective? And with the fertility awareness method, of course, it has a long history of being equated with the rhythm method. So, I mean, modern day fertility awareness-based methods are not the same as kind of the rhythm method. So the rhythm method was based on calendar calculations, and there are still certain methods that are based on calendar calculations, but as a fertility awareness educator, fertility awareness-based methods, it's very different. So rhythm, you would basically chart enough cycles to have an average, to be able to calculate an average, and then you would use your past cycles to predict when you would ovulate. And it's not an effective method of birth control for the vast majority of women, because cycle fluctuation is normal. The one thing all women have in common is that all women experience some degree of menstrual cycle fluctuation. So with fertility awareness-based methods, we are monitoring the 3 main fertile signs. Not all methods monitor all 3 signs, but the main 3 signs would be your cervical mucus, as we talked about, your basal body temperature, so your temperature if you take your temperature every day in the morning before you get out of bed, and your cervical position changes. So the cervical position is optional, but when you watch these, pay attention to these biomarkers, you can identify throughout your cycle on any given day, really, if you're fertile or not that day. So it takes into account the fluctuations that you experience. Often, you'll see information about fertility awareness on different websites that will say you can only use it if your cycles are perfectly regular. If your cycles are ever irregular, you can't use it, making it because it equates it with the rhythm method. But for instance, I teach my clients to be able to check their cervical fluid on a daily basis, to check their temperatures, so that they could literally say to themselves or their partner or me, I'm fertile today because I saw mucus. I'm not fertile because I didn't. I know I ovulated, around this day because I monitored the changes in my cervical mucus and my basal body temperature. So it's a very different approach. It has been studied scientifically, and so when used correctly, the fertility awareness method has been shown to be up to 99.4% effective. But I mean, it has a huge difference between our modern hormonal methods. So for instance, like the patch or the shot or even the pill, there's a difference between like why methods might fail. So like user failure versus method failure. So method failure is actually if the method doesn't work and you use it correctly and you still get pregnant, whereas user failure is like the condom is not even on. So can't really work, can it, right?
Mm-hmm.
So with the fertility awareness based methods, it's all user. It's like, or what I'm trying to say is like, it's on you. Like if you have an IUD inserted, the only way it can fail is if the method fails, which can happen, but the chances are lower, right? But if you are charting your cycles, well, if you don't chart, if you don't pay attention and all of that, then it's a little bit different. So I think in our culture, and especially I've interviewed a number of doctors and health professionals, there's certainly the sense that it's too complicated, women aren't able to do it, and because it's so dependent on that, like the woman understanding and kind of following these rules, we're often kind of dissuaded to do that. So what I often say is that fertility awareness is not for everyone. Every single woman doesn't want to use fertility awareness. Every single woman, even if she likes the concept of it, it might not be right for her at every stage of her life. But for the women who gravitate to this method, who choose to learn it, who work with an instructor, who take a class, who educate themselves in whatever way makes sense to them, and chart diligently and use the method, it works. So it's kind of one of those things where women self-select, yeah.
Good. And yeah, I see that as well. A lot of people do have anxiety and they just find it too overwhelming. Maybe they've got a lot going on. What other alternatives do these women have if they definitely don't want to go back on the pill, but they want to do something more natural and that doesn't interfere with the hormones? What recommendations would you give them?
Well, I mean, essentially when you're avoiding pregnancy without hormonal birth control, there's like a menu of possibilities that are available to you. And it really depends on you, what you are comfortable with, what your partner is comfortable with, what makes sense for the two of you and within your relationship, and what your partner is willing to do, what you're willing to do. Right?
Mm-hmm.
So essentially, I mean, you have a variety of options. For some women, they'll combine fertility awareness, like so having that general understanding of their cycle with other methods. So for instance, on the menu includes condoms. Some couples are completely fine with condoms. Other couples don't find condoms to be acceptable. Some couples use withdrawal. I always talk about withdrawal because it's one of the methods that is considered a non-method, and I've had many conversations with clients that kind of look to the floor like, who uses withdrawal, like, and kind of like shameful kind of thing. But I talk about withdrawal because simply a lot of people actually use it. And so it's kind of one of those things where if you're going to use it, you need to know how to use it correctly. The research would indicate it's up to 96% effective when used perfectly. And the big point of contention is there sperm in a man's pre-ejaculatory fluid or not? The research is not conclusive. So some research studies show that there is none in the participants that they studied. Other research studies show that some men have it and some men don't. But either way, up to 96% effective when used correctly, and then typical use is closer to like 70-something percent. So some couples will use withdrawal. Some couples will use some other type of barrier like a diaphragm or a cervical cap. And so using those methods correctly, you're supposed to use them with spermicide, I would recommend like a non-toxic, no naloxone 9 type spermicide. And then, some couples will combine the two. So they might use diaphragm with condoms, or they might, use condoms or use with withdrawal, or like some sort of combination. For women and couples who are practicing the fertility awareness method, really it comes down to how to manage the fertile window. So the fertile window, when you're using a specific method, from a scientific perspective, you're fertile up to 5 days before ovulation plus ovulation day, 6 days. But when you're using a method, you have to add in the buffer period and all that. So typically there's at least a 9 to 10 day window in the cycle that is kind of, what are you going to do? And so again, some couples will use those different examples that I shared, and some couples will kind of avoid penetrative sex during that time. So they might enjoy other types of sexual activity that doesn't involve penis and vagina. Some couples will abstain for that period of time. So it really depends. And the challenge is that it requires the cooperation of your partner. I personally think it's time that we can have that conversation. I think that the reign of men being able to do whatever they want, and us having to modify our actual physical bodies with hormones in order to allow him to continue to be able to ejaculate inside of my body. I feel like we've made all the concession to this point. So I feel like we've reached a time where we can have these conversations, and women can have more agency in not being on hormonal birth control, but still having their partner's cooperation to find ways to avoid pregnancy. But again, it's not the same in every woman's relationship.
Yeah, everyone's different, and yeah, there's plenty of options there for people to research into and see what works for them. And yeah, like you say, it can change over the years. If fertility awareness works fine for you now, then great, and then you can maybe switch it up in a couple of years when it's just too much and you're not going to be doing it as accurately and consistently. I've just got a few questions on each of the tracking signs. The first one with cervical mucus. What about if someone doesn't see any? So if they're not producing cervical mucus at all, what would you say to that?
Well, the first thing, of course, as an educator, I would want to know how they're checking for their mucus. So there's different ways to check. Some women check internally, some women use toilet paper, but the first thing I would establish is are you checking enough? Is there actually mucus there? Is there not? What are you actually seeing, etc. So if we've done all of that and established that she's not producing any, there are reasons for that. So typically what I've seen is if a woman has like nothing, I have seen dry cycles. I've seen it a number of times in women immediately off the birth control pill. So and it doesn't happen to every woman. So just to put it out there, I've seen women immediately off the birth control pill who do have mucus. Albeit the patterns typically take a few cycles to normalize, but I have seen it a couple of times where a woman will come off the pill and the first 2 cycles, 3 cycles, nothing, dry, no mucus. And then as their cervix begins to, get back to normal, their hormones begin to normalize, then they begin to see their mucus patterns. Limited mucus production can be related to a number of different things. It can be related to hormonal production because your mucus is produced directly in response to your estrogen levels. And it can also be related to the actual physical health of your cervix. So women who've had a history of, HPV, like an HPV infection that was consistent, that didn't go away, that lasted for a long time, cervical dysplasia at various levels, women who have experienced those issues and then had to have some sort of surgical procedure, laser procedure, etc., to remove abnormal cells from their cervix. Any procedure that you have to the cervix has the potential to damage the cervical crypts where the mucus is produced. So I've also seen women that have had those types of histories with their cervix and abnormal cells and surgeries and things like that, that there's a physical reason why they're not producing mucus. Stress and other endocrine issues can cause that. If a woman is not, like if a woman has hypothalamic amenorrhea and she's like not even ovulating well, she's not going to see any mucus. And I'm trying to think of, those are the immediate issues that come to mind. And also if a woman actively does have abnormal cells or cervical dysplasia, then in many cases, she might actually show less mucus than is normal. So yeah, those would be some of the reasons why a woman doesn't see it. And so in any of those cases, like if it was immediately post-pill, well, we need to support your body. We need to support, replenish some of those nutrients, make sure that you're eating a diet that supports hormone production. So we produce our steroid hormones, estrogen, progesterone, testosterone, cortisol, even vitamin D. It's directly synthesized from cholesterol. So if your diet doesn't contain any animal fats, and you have an issue with hormone production and you are noticing all of these concerns, then you may have to consider that, because literally the hormones are produced from the cholesterol. So so that's a consideration, like the dietary aspect of it. The consideration of just allowing time for your body to normalize post-pill, addressing nutrient deficiencies. The cervix requires folate, vitamin A, B vitamins in order to produce healthy mucus. So just kind of making sure you're covering your bases. So yeah, I mean, I could go on for days because this is what I do, but I think I'll stop there.
Yeah, I've also seen dehydration and antihistamines leading to, clinically, leading to low cervical mucus production. And what about for someone who is seeing that stretchy egg white cervical mucus multiple times throughout the cycle? So maybe they've got excessive cervical mucus and they think that they're ovulating, they see an increased production, and then it goes away and then it comes back maybe 5 days later. What could be going on there?
Well, you just jogged my memory of a couple important points to mention. As you mentioned, the antihistamines, I've seen that before. If you are taking allergy medication, it's so interesting how it can completely drive the mucus. But it's just another thing to mention. Women who've gone through certain types of fertility treatments so for instance, like Clomid, there's a lot of research on how Clomid can negatively impact mucus production because it changes the way that your cells respond to estrogen. So it makes your cells resistant to estrogen. So then you're making all this estrogen and your cells are resistant to it. So that would mean that you wouldn't produce mucus, right? So just kind of medications and things. That's a good point. So thank you. In terms of the opposite, like producing a lot, I mentioned kind of polycystic ovary syndrome and how the classic chart typically involves like longer cycles or more irregular cycle presentation. So it's not uncommon for a woman then that has a longer cycle. And what a long cycle means is that her ovulation is delayed. If a woman has a 46-day cycle, it typically means she probably ovulated closer to day 32 or day 33. Because the second half of the cycle is pretty stable. It's not always exactly the same, but it doesn't fluctuate nearly as much. So in a situation like that, if you see like several days of mucus that's clear and stretchy, and then, it goes away for a bit and then it comes back, that just typically means that your body is gearing towards ovulation. The follicles are maturing and producing estrogen, but something is happening that is causing that to kind of back off for a while. And so typically it's a combination. It can be related to stress if it's an issue like polycystic ovary syndrome, which is characterized by the insulin resistance and inflammation, all these types of things. It's often related to that combination of diet, all kinds of things that are happening. In other situations, if a woman has mucus every single day, for some women, it can be an early sign of some sort of infection. So for some women, before they're even itchy, they might notice that they have a consistent pattern of creamy mucus all the time. And that could be an indication of a yeast infection if it's happening like all throughout the cycle. Because in a healthy cycle, you would expect to see the mucus around ovulation, not all the time. I've also seen women who have gut issues, gut infections, they're somewhere on the IBS spectrum, they're consuming foods that they have a sensitivity to, and it just seems to cause this consistent pattern of just mucus all the time. And if they identify the food that they're sensitive to or kind of address some of those gut issues, then they'll see that stop, and then the mucus will be where it's supposed to be around ovulation. So mucus is super interesting in how it can